distinguished participants and request your attentive engagement throughout the session. It is my privilege to invite our first speaker, Professor Dr. Gopal Nath, a professor of microbiology and Dean Research at Banaras Hindu University with nearly 4 decades of teaching and research experience. A pioneer in the bacteriophage therapy in India, Sir is to deliver his lecture on the topic Bacteriophage therapy, panacea or pragmatic adjunct. Lights off. May I invite Professor Dr. Gopal Nath to kindly take over the stage for his address. Over to you, sir. Our chair for the session, Professor Dr. Sharat Kumar Mishra, has joined us. Now we'll start with the first lecture presentation. Professor Gopal Nath, sir. Over to you, sir. Thank you.
Namaste. Namaste, everybody. It is really overwhelming for me to be here at this campus. And I was just thinking that I should speak about this sometimes in UP also. I have spoken all around the country, even outside also. But I think this is the first major gathering where I'm addressing on this topic. And before going to this, because वो कहते हैं ना कि दीन का कीड़ा अभी भी रेंग रहा है, तो मैं थोड़ा सा माइक्रोबायोलॉजी क्या होता है और माइक्रोबायोलॉजिस्ट क्या ये समझा दें. यहाँ भी आयुर्वेदा फैकल्टी है. तो 30-40 साल पहले when I asked my friends that what do you think about the bacteria and viruses, so they told me that they know up to creamy. Creamy means small parasites जो होते हैं जो naked eye से दिखाई पड़ते हैं. तो मेरी समझ में आया कि ये तो naked eye के beyond जाते नहीं. Then I said, what do you say about the things which are not visible to you? They said that we say that they are bhutaj and pretaj. तो मेरी समझ में आया कि भूताज प्रेताज का मतलब है कि हम लोग भूत प्रेत के एक्सपर्ट हैं. जो लोगों को दिखाई नहीं पड़ता है वो हमें दिखता है. तो अपने को माइक्रोबायोलॉजिस्ट का तो ये डेफिनेशन है. यू शुड बी प्राउड दैट यू आर द एक्सपर्ट ऑफ भूताज प्रेताज व्हिच कॉमन पर्सन कैन नॉट सी. यू कैन सी देम. सो एंड देन रिसर्च की जहां तक बात आती है, किसी ने कहा कि वी आर नॉट हियर, आपके वीडियो में दिख रहा था, वी आर नॉट हियर फॉर स्टडिंग ओनली, वी आर हियर फॉर इनोवेशन टू. व्हाई वन शुड डू इनोवेशन? क्योंकि जब मुझे मोटिवेट करना होता था एज ए डीन, तो मैं एक एग्जांपल देता था. बहुत सारे क्लिनिशियंस भी बैठे होंगे. आई फील दैट दे शुड नॉट माइंड इट व्हाटएवर आई एम गोइंग टू स्पीक. अ सर्जन इज गोइंग टू परफॉर्म 6 सर्जरी. आप मेडिकल प्रोफेशन में हो या नहीं गए हो तो भी, और अगर हो भी तो भी आप इनोवेशन कर सकते हो. उसका इंपॉर्टेंस समझिए. 1947 में जब देश आजाद हुआ, हमारी लाइफ एक्सपेक्टेंसी वाज 49 years. We added 10 more years with the help of vaccine and antibiotics. अब एंटीबायोटिक्स की प्रॉब्लम हो गई है, तो हम सारे होमोसेपियंस मिलके एक मीटिंग कर रहे हैं कि व्हाट टू डू विद दिस. दिस इज द पार्ट ऑफ दैट सिस्टम व्हिच वी आर डिस्कसिंग अबाउट दिस. सो 10 years जो ऐड हुआ वो एंटीबायोटिक के एडिशन से, जो हमने 1940 से जर्नी शुरू की थी. और वो 10 years में वैक्सीन का भी रोल है, वो भी माइक्रोबायोलॉजिस्ट ने ही किया. So you should be proud of this for the innovations done by the microbiologists, that 10 years has been added to the means lifespan of whole Homo sapiens throughout the world. दूसरा जो 10 years add हुआ, that was because of the better nutrition and better hygiene. तो हमारा 49 से कितना हो गया? 59, 59 से 69, और अभी थोड़ा और बेटर हुआ है, तो we have gone, इंडिया में 72 के आसपास चला गया. And major contribution is from this experts of Bhutaj and Pretaj which we have done. And why one should do research? Research इसलिए करना चाहिए, एक clinician बन जाता है. I opted microbiology after my MBBS because I was thinking to be a microbiologist doing some innovation way back in 1985. तो उसमें एक सर्जन एक दिन में 6 सर्जरी करता है, मेजर सर्जरी, और महीने भर में 180 करता है. उसको राउंड फिगर 200 कर दीजिए, 12 महीने में 12 दूनी 24, राउंड फिगर 2500 कर दीजिए, 10 साल में 2500 करे, 25,000 करेगा, अगले 10 साल में 50,000 करेगा, अगले 10 साल में 75,000 करेगा, अगले 10 साल में 1 लाख करेगा. तो 1 लाख लोगों को उसने पर्सनल बेनिफिट दिया इंडिविजुअल लेवल पे. और एक फिजिशियन उसका 10 टाइम्स करता है, वो 10 लाख लोगों को दे सकता है एडवांटेज. लेकिन आप इमेजिन करिए, जिसने पोलियो वायरस का इन्वेंशन किया उसने कितने लोगों को एडवांटेज दिया होगा. किसी ने एक डायग्नोस्टिक किट खोजा होगा, उसने कितने लोगों को, मिलियंस एंड बिलियंस में होता है. तो नाउ यू हैव टू डिसाइड द यंग माइंड. आई एम टेलिंग यू दैट व्हाई वन शुड डू इनोवेशन एंड एनी वन ऑफ यू कैन डू द सेम थिंग. डॉक्टर भट्ट साहब ने इंट्रोडक्शन बहुत बढ़िया दिया. माइक्रोब्स के नंबर पे मैं फिर से रिपीट करता हूँ. द नंबर ऑफ यूकैरियोटिक सेल इन ह्यूमन बॉडी इज 10 पावर 13, 1 ट्रिलियन. और आपने बहुत राइटली बताया 10 टाइम्स ज्यादा बैक्टीरिया होते हैं हमारी बॉडी में. जितने म्यूकोजल सर्फेसेज हैं सब पे बैक्टीरिया. और मजे की बात है, जिसपे मैं बोलने जा रहा हूँ वो 10 टाइम्स ज्यादा बैक्टीरिया से होते हैं. तो 10 पावर 13, 10 पावर 14 एंड 10 पावर 15 वायरसेस हैं. Those viruses include bacterial viruses and the human virus. Because bacteria are so many in number, so every cell is surrounded by 10 viruses in whole earth, means living world. Even soil में भी है, plant में भी है, animals में भी है, everywhere. ये proportion 1:10:100. तो 99% of our body by number are the microbes. अब माइक्रोबायोलॉजिस्ट अगर बनो, बायोटेक्नोलॉजिस्ट बनो, बायोकेमिस्ट्री बनो, तो आई थिंक यू आर डीलिंग मोर लार्जर पॉपुलेशन. ठीक है, इसलिए वन शुड बी प्राउड ऑफ दिस एंड वन शुड थिंक दैट यू कैन डू ग्रेट थिंग बिकॉज रिसर्च हैज बीन डन टिल डेट. maybe 1%, 2% of the knowledge we are having only with this. So with this background, I think you must be doing something novel. You can help the humankind in a better way, or means in a great way, by doing some innovation. And those innovations may be the epidemiological data which we don't know, you can have that one. You are having new molecule for the treatment. You are having new diagnostic technique, and you are going to explore or to find out the etiology of the unknown diseases. That is very important. So these are the things which will, and these 4 or 5 aspects are there where you can, and the research should be something novel. There is nothing like that you are repeating the work. Please don't repeat. Don't do the research, but don't repeat the repetitive work. So I'm just going to tell you about the whatever bacteriophage work I did, and bacteriophages are the viruses of the bacteria. And you know that antibiotic first time introduced in 1940, penicillin, and within 1 or 2 years the resistance was there. And before going to this, I will be telling you the basic philosophy of the antibiotics and also of the bacteriophages. And what antibiotics are. In nature, they are already present. And antibiotics are the molecules which are the signal molecules for the crosstalk between the microbes. What we do is, and this crosstalk is for just warning the fellow members to relax, not to multiply, not to be active, because they are a stressful condition. What humankind did is that they find out those molecules, and if you are using in the larger, so rel-A gene is there, relaxation gene. So they are just telling, जैसे जंगल में शेर आ गया और बाकी ह्यूमन काइंड है, हिरन है, चिड़िया है, तो सभी एक मैसेज देते हैं कि छिप जाओ, शांत हो जाओ, इधर उधर भागो, नहीं तो शेर खा जाए. इस तरह के जब स्ट्रेसफुल कंडीशन आती है तो एक बैक्टीरिया दूसरे को बताता है कि हैव एक्सप्रेस योर रिलैक्स rel-A gene so that you are relaxing and sitting silent. लेकिन अगर उसी सिग्नल मॉलिक्यूल का आप कंसंट्रेशन बढ़ा दोगे तो इतना रिलैक्सेशन हो जाएगा कि फिर वो रिवाइव नहीं करेगा, जबकि उसको रिवाइव करना है. दिस इज एंटीबायोटिक मॉलिक्यूल. अब बैक्टीरियोफेजेस क्या है? नेचर में सर्वाइव करना है बैक्टीरिया को, एंड बैक्टीरियोफेजेस आर बेसिकली फॉर द सर्वाइवल ऑफ द बैक्टीरिया. They are there. They are also for us. If अगर आपके I belong to Jaunpur, sir also belong to Jaunpur. जौनपुर में एक मूली एक जगह है जहां पे जौनपुरी मूली 40 किलो तक का रिकॉर्ड किया गया है. उसी सीड को कहीं और ले जाके लगाएंगे तो आधा किलो 1 किलो से ज्यादा नहीं होता. The reason is the microbiota of that soil. सीड वही है, एनवायरमेंट वही है, सिर्फ माइक्रोबियल फ्लोरा विच इज अफेक्टेड. अगर आपके गट से माइक्रोफ्लोरा डिस्टर्ब कर दिया जाए, चेंज कर दिया जाए, तो आपका हेल्थ डिफरेंट हो जाएगा. तो दिस इज द इम्पोर्टेंस ऑफ माइक्रोबायोटा. अगर आपके इंटेस्टाइन से हम सारे बैक्टीरिया हटा दें, यू आर नॉट गोइंग टू सर्वाइव. दे आर एसेंशियली नीडेड. एंड the bacteriophages, what they are doing, they are producing a lot of variants. They are the genetic engineers of the bacteria. The variants are being produced to face the stress whichever is they are going to face. So some of the mutants are going to survive. So basically they are there for help. And there are lytic viruses and they are all lysogenic. I shall be telling you. So lytic viruses are just lysing the bacteria, and that is essentially needed because the bacteria are the entity which are going to synthesize the complex molecule out of the elemental components. No other person can do it, no other living entity. So that they are needed for the higher animals and plants. So this is the part of the food chain that they are doing by the lytic cycle. And then other thing, they are creating a lot of mutants. So we are using the advantage of lytic cycle present in the nature. But if you are using single phase, the mutants will develop within 20 minutes. So what we are doing, we are having the cocktail of different viruses so that if the mutants are coming out, another bacteriophage is going to kill. So single bacteriophage cannot be used in the clinical practice. So with this introduction, I am just presenting my case, and I shall be speaking in 3 ways: treatment of chronic ulcers, treatment of the trauma infections, and also the septicemia, which the Vice Chancellor sir has told about that the death of some VIP person due to Klebsiella pneumoniae. And I'm also going to speak about the Klebsiella pneumoniae in a case of septicemia, where the patient was going to die within 3-4 days, as the sepsis markers were there. So till they are doing some corrective measures, the thing is that the chronic ulcers are defined as the ulcers which are not healing in 6 weeks duration or maybe more. Sometimes we have treated the cases 6-year-old also. There are biofilm formation where the antibiotics cannot penetrate, but the bacteriophages are the live entity. They are producing certain enzymes and they are making more penetrable so that they can have the effect. In the trauma wounds and the roadside injury, road traffic injury, the wound is usually contaminated with the soil bacteria. And if the infection is there, it is very difficult to eradicate them also. And in case of septicemia, which is occurring because of the drug and all the antibiotics, none of the antibiotics are effective. And you listen about the cost of this ephedrine, 35,000. And for one case, you are going to spend 16 lakh. And with this technology, which I am going to tell you, you can treat those cases in 3,500 only. 500 per day, not more than that is needed. And that is definite cure. Only issue is the regulatory body, and we have not still permitted because they are the live entity. So that is the issue. तो आगे बढ़े फिर. So this is okay. Next. So this is the bacteriophage, and they are the genetic engineering of the bacteria, which I told you earlier. Next. So for the UGs, it is very difficult to remember the mode of action of the site of the action of the antibiotics. So I made the mnemonics when I was, I think, third year resident, way back about 30 years ago. You can see next. You can see cell wall is inhibited by beta lactam. So all these mnemonics are telling that these are the antibiotics which are working on cell wall. The another is cytoplasmic membrane is inhibited by tripol. They are the usually antifungal, and these antibiotics are acting at cytoplasmic membrane. And the RNA square, on RNA square works rifampicin and rifabutin. Next. Protein synthesis is inhibited at CMC Ludhiana. You can just remember aminoglycosides, tetracycline, chloramphenicol, and on DNA, it is Queen Mary Act on the DNA. So here you can see, okay, it's not working. So these are the different sites, and one is the antimetabolites, which is trimethoprim cotrimoxazole, and this is coming later on. And these are the source of different antibiotics. Nowadays we have used so hugely that we are assembling here to discuss the AMR-SHIELD 2026 at this campus. And you can see that these are the how we started this penicillin, means discovery of the antibiotics and addition to the our armamentarium. But after 1980, we have added only few molecules. The pipeline is dry. And this is the end of the road for the antibiotics. You can see this is the major area, 1940 to 1980. After that, we don't have much. So then what to do next? We have to discuss here. And there are alternative ways to treat the AMR status. And one of the aspects is bacteriophage therapy. I shall be speaking on that. And we were so, ignorant about this. One of the surgeons said, because surgeons think in other way, not like microbiologists. We are the microbiologists, tantrics, ojhas and sukhas, knowing about the bhutas and pretas. So we think differently. He said in 1965 that it is time to close the book on infectious diseases and declare the war against the pestilence own. But later on, you see what happened in Corona time. We have seen the music of these bugs, maybe virus, maybe bacteria. And then, sorry. So superbugs, man thinks that they have developed the AI and they are super intelligent, but it is not that the case. The microbes are much more intelligent than us. Every 100 years, we are having one pandemic and ruining, means killing a lot of human population. And the bacteria are quick decision makers. Superbugs are a strain of bacteria that is resistant to all the antibiotics. So you know there are many superbugs reported. And then this child thinks that if there is an issue, there is a solution of everything. Nature has got given. दुनिया में दुख है तो दुख का कारण भी है, तो कारण है तो उसका निवारण भी है. गौतम बुद्ध ने यही कहा था. तो अगर कोई इशू है तो ऐसा नहीं है कि उसका कोई सलूशन नहीं है. इट इज यू टू फाइंड आउट. दिस इज व्हाई वी आर डिस्कसिंग दिस इशू हियर. So one is the bacteriophages. They are bacteria eating viruses. And then number of viruses and bacteria and archaea are 10 power 13, 1 on this globe. Process of isolation of bacteriophages is very simple. We have to give the substrate or the host, like we do the cell culture cell lines of the human being. We are usually using cancer cell lines. we are using the bacteria as such. You are make the lawn culture and collect the water from the sewer or water for wherever you like. You can just simply use your urine sample also, because urine is all the time excreting these viruses. Everybody is excreting saliva and this one. And we are basically the source of these bacteriophages to the river water, maybe Ganga, Jamuna or any sewer. And then you are getting the plaques. It takes usually 48 hours. These are the electron micrograph of this one. You can appreciate the head and the tail of the viruses. So these are the different viruses. You know the cycles. This is lytic cycle, where the bacteria is killed because they are replicating in such a huge number. They are making holes, they are coming out, or the bacteria is getting lysed. So we are taking the advantage of this system only. And there are lysogenic also, where the different character are given to the bacteria, which I told you that they are enabling them more. All these toxins which are present mostly are transmitted through the agency of bacteriophages. That is called as lysogeny, maybe tetanus toxin, botulinum toxin, or the diphtheria toxin, or cholera toxin. They are all being transmitted through the bacteriophages, and they are incorporated in the genome of the virus. So these are the plaques you can appreciate. If the number is this, you can see the plaques like this. If you are increasing further, the plaques are increasing. If you are increasing further, the plaques are looking like this. If you are increasing further, whole plate is cleared, and you can see the bacteria is Klebsiella pneumoniae. And if you are using the high count of the bacteriophages, this is the clearing of the whole plate. The same thing is going to happen in your body also. So first case I am showing you, otherwise I will be showing you. This is a case from Hyderabad, and he was suffering from the chronic ulcer of the heel area for more than 6 months, and the surgeon said that we are going for the amputation. And then what we are doing, that ethically we have to take the consent of that patient and also the two treating physician that they are ready, because regulatory body has still not allowed us. However, we are taking the permission from our ethics committee, institutional ethics committee, and for surface issues there is not much problem. And we have used, I think we have treated more than 600 cases at our hospital. So he developed ulcer on you can see the date. And all the conventional therapy was done on VAC and antibiotic, local treatment, systemic antibiotic, local antibiotic, antiseptic, sepsis, but without any avail. And there was the bone infection also. He was suffering from osteomyelitis also. So this is the case. And you can see that the bone is involved there. The pointer is not working, otherwise I will be showing you. So we isolated the bacteria. The bacteria was Staph aureus in this case. We prepared the bacteriophage. Patient was, and then patient was, we just invited him to be at BHU. He is. So, and then we started the therapy. You just mind the dates. This is the first day we gave. This is after 1 week. And what we do is, we are having this trial gauge piece, soaking the phase preparation. Count is usually 10 power 8 to 10 power 9 per ml. And then putting overnight over there. The patient is just sleeping. And next day we are doing. So whole night the bacteriophage is working there and they are just clearing. So very simple. And we are not using any antiseptic, any betadine, iodine compounds, because the bacteriophages, being protein in nature, they will be denatures and they will not be surviving. So this is a special care you have to take. However, the antibiotics are having nothing to do with this. You have to take care of the antisepsis. So this is the after 3 weeks, after 34 days, 41 days, and bone is still there. And then I said that the bone can be removed there at Hyderabad only. So none of the surgeon was ready to remove it because they said that I don't know what therapy you are doing. So I said, you come to BHU, we will do this. So because surgeons are collaborating with me, so they said we will do, and he came to Varanasi. And you can see this is it takes time. And this is you can see the spur formation that shows the bone osteomyelitic features were there. This is the comparison with the normal X-ray. And then so if you just calculate, this is the 4 months. Bone came by itself. Nothing was done. And then this is the total picture. And we followed after 4 months just to see that is there any recurrence. And you can see there was no recurrence. The patient was treated. It is cured. So we started day 1, and you can see on 183 day, it was, so there was no need of amputation. You could say the patient was diabetic. So this bacteriophage therapy doesn't bother about whether the patient is diabetic or not. But during therapy, the diabetes should be controlled. So this is the one case. Then you can see the other case, because we did the case control study, randomized control trial, and you can see the surface became sterile after 12 weeks in this case. Then we can go for the superficial skin grafting. Patient was very poor from Gaya. She denied, she went back, but it will heal, but the fibrosis will be there. This is another case. Unfortunately, it went to the control group where we did not use the bacteriophage therapy. And you see what happened after 6 weeks. So this was in wound condition after 11 weeks of the treatment, conventional treatment. You can see this has happened. So it was worsening. So we started our therapy because ethically we have to, whatever we are having modality with us, we cannot deny that advances to be given to the control cases also. We started the therapy. You can see after 2 weeks of the treatment, there is improvement. And after 4 weeks of the therapy, you can see there is further improvement. And then after 8 weeks, within 2 months, this is almost cured. Otherwise, that patient was suffering from more than 1 year. So part 2 is the bacteriophage therapy of infected. This is chronic ulcer, and we have treated more than 600 cases. I am just showing you a few of the cases only. And then this is another part 2 is the bacteriophage therapy of infected traumatic wound, a case control study, another general surgery MS thesis. And there we did through the permission of the ethics committee, we started this work. This duration was 2018 to 2020. And you see, so patient with above right elbow amputation showing wound 20 days after conventional therapy. After conventional therapy, when we cultured from the swab from the surface of this amputation, this is knee joint, the bacteria were still present over the surface, and there was no healing. This was in the control group. Here again showing right shoulder disarticulation, patient underwent CT, the control therapy. Wound was not sterile after 21 days. In this case, we did this is degloving injury, and that was infected. And in this case, the right foot underwent phase therapy with complete granulation tissue on day 8 and sterile wound on day 14. So when the surface becomes sterile, the surgeon usually prefer for going the SSG. The skin grafting is done and the healing becomes faster. So with the antibiotic, it was not happening in control cases you have seen. But if you are doing the bacteriophage therapy, you can achieve this very early. So you can avoid a lot of complication and the duration of stay in the hospital and expenses as well. This is another case. Extensive degloving injury of right leg. Patient underwent bacteriophage therapy with complete granulation tissue on day 16 and grafting was done on day 20. And you can see the granulation tissue, the grafting has been done and it is very fast healing. This is not working. So this case, again, we did the bacteriophage therapy, the amputation at the knee joint, and you can see with bacteriophage therapy only, that spontaneous healing covered by the skin without doing any surgical intervention. You can see the अरे वो वर्किंग कर रहा है, ये कहाँ पड़ रहा है, बहुत तेज बहुत. So if you see the effect of the final intervention cases with the bacteriophage therapy, skin grafting could be done in 74.1% of the cases. With the control, only 33.3% of the cases. The difference is significant. Wound closure by second degree or third degree intervention, first degree intervention is this much, 18.5, while it was very high. It will lead to the contracture and fibrosis and contracture. So there is more complication. Again, the bacteriophage therapy was superior. So you can see the shows days required to attain complete granulation tissue. With the full granulation in 15 days, while with the control means surgical intervention, only the duration was 23 days. It was again significantly higher. And then final intervention could be done on 25th day. But in this case, control the classical surgical intervention, it took 43 days. And the days duration was still significantly less than the conventional therapy. And the total cost we calculated like antibiotic drug, non-specific BT, and then we did not withdraw the total conventional therapy from any of the groups. Conventional therapy was given to both the groups. The bacteriophage therapy was an add-on to that one. So ethically we cannot do that. So we did not do that, but we added the bacteriophage therapy in one group and no bacteriophage therapy in another group. So that was the case. And you can see the expenditure difference, 38,500 average, and here it was 1,36,000. So it is very significant different. And phage therapy is much cheaper, but it is customized. You have to prepare in your lab. This is not at the counter, it is available. So this was published. So the third part I'm showing you, this is very important about the Klebsiella pneumoniae itself, which was resistant to cholesterol as well. And this patient was a mother of one of the scientists of DBT working at Delhi, but he belongs to Padrona. And somehow I was delivering a lecture at Chennai conference. So one of his colleagues listened about that one. And when she became very serious, then he contacted on phone that I told that one of PhD scholar has having all these preparations with this because he was working for last 4 years, purified, endotoxin free, a huge volume was there. And 3 broad spectrum bacteriophages were there. And we are having the cocktail of that one. So we said that we can immediately start with it, but otherwise we'll isolate the bacteria, have the customized phages isolated, then we can start the therapy. Luckily, all the 3 phages were effective against that bacteria isolate, and we can start. So this patient was having injury in 2009, and she was operated several times. And then third time she developed the So again, there was accident. She, while riding on the e-rickshaw vehicle, rod fell on the implant side of that thigh where the hip replacement was done. Since then, the pain and swelling started. And then she visited the surgeon at one of the private hospitals. She got infected, and the bacteria isolated was Klebsiella pneumoniae. And then it was resistant to all the antibiotics. So then now surgeon said we cannot do anything. That was the case of the sepsis. You can see the PCT, procalcitonin, If it is more than 1, it is really serious condition. Here you can see it's healthy adults, it should be less than 0.5. But here in this case, you can see this is 5.25, very high. And this is the range where systemic infection is possible, but other conditions are also there. And CRP was 240. CRP should be very less than 10 usually. Blood urea, it should be maximum 40, but it was 121. And then creatinine was 3.5. So it means renal function was also disturbed because of the septicemia. And then total leukocyte count was 28,740. The usual higher range is taken as 11,000. So it was much higher. So, and when I asked one of the interviewers of my colleague that how long she was going to survive, so they said that within 3-4 days, this situation will worsen because we are unable to treat the bacterial infection, which was Klebsiella pneumoniae. And then you see she was having first discharge in the volume of 150 to 200 ml per day. So again, we took the consent from the patient party and also from the treating physician. 2 physicians signed over there. And then we immediately provided her with the cocktail of 3 well-characterized broad spectrum phages. And then we subjected the pus to the culture. We isolated the Klebsiella pneumoniae. We tested. We found that that was resistant to all the antibiotics. And then these were the phages. These phages were all whole genome sequence because it was the PhD topic. Already it was done, so there was no issue of knowing about the presence of AMR gene or any other virulence gene. So the electron microscopy was done. So we started the therapy at 2:30 p.m. The 2 ml of fast cocktail of the amount 1.10 power 9 per ml PFU diluted in 20 ml physiological saline was applied over the wound surface. And we were just pushing inside. You will see the wound also. So initially what is happening that maybe there are some adverse effect because a huge number of bacteria are there. So if you are adding the bacteriophages, there is further lysis of the bacteria, release of the endotoxins. Endotoxins may be coming out of your preparation itself, although we took care of that one. But sudden lysis in the body may lead further add on to the sepsis, and patient may go to the serious condition or may die. So that's why we were just taking care of all these things. Patient was admitted to ICU to monitor her blood pressure and also the oxygen saturation. So next day we got the pure growth of Klebsiella pneumoniae. The antibiotic sensitivity testing was done and the lytic activity of each of the 3 phages was also tested. All the 3 phages had lytic activity and the isolate was resistant to all the drug tested, which included cholesterol and imipenem as well. So that was basically XDR. So on the second application of bacteriophage composition, at the same strength 2 ml of the fast cocktail diluted in 20 ml of saline because wound size was huge. That's why we are using the large volume of the bacteriophage preparation. Was done on December 4 at 7 p.m. No febrile reaction occurred or rise in blood pressure could be noted in this time. First time there was some issue because maybe the number of bacteria were lying on the first application. Now the number has decreased. That's why we are not having adverse effects. So we continued with the therapy. Day 4, total leukocyte count was recorded 50,800, which came down from 28,500. So after 72 hours, we got the effect. So there was a drastic reduction in the total leukocyte count, which is the indicator of sepsis. And there was a reduction in pus discharge as well. So since there was no apparent adverse reaction, we decided to apply fast daily with the same dose and daily pus and pus swab culture. So we were doing daily culture, that what is happening. So this was the area of the wound. So initially we did not open the stitches. We said that you push through the syringe inside the wound. This was huge area. You can see the long, this one on the hip joint. And then on day 5, total leukocyte around 15,000. Fortunately, again, there was the lysis. But when the Klebsiella pneumoniae went down, the number became, few of the colony were growing. So unfortunately, we got another bacteria that was Acinetobacter baumannii, which is again very resistant type of bacteria. So what is happening in the body that there may be the mixture of the infection, but one bacteria inhibits the other one. So one is getting, when they're getting rid of one, the other is starting multiplying, because we are not using the bacteriophage against the Acinetobacter. So then we isolated, and for this we had to prepare the phages. It took a few days, and then we started the therapy with the Acinetobacter baumannii also. And then on December 7, day 7, the serum port calcitonin came down to 0.298 from 5.23. Drastic magic effect was there of the phase therapy. And then blood urea became 36 out of 125. It came down to normal range. Creatinine again came to normal range, and CRP was 71.4 from 240. So patient was now not going to die. We were sure about this. And then the new isolate could be confirmed as A. baumannii and subjected to screening for 10 purified phages available with us. So we are having, at least I was having at that time, almost 8 PhD scholars working the topic on different bacteria, and we were using on the animal model and sometimes also coming to the human cases. So this Staph aureus, escape organism Enterobacter, Klebsiella pneumoniae, Staph aureus, and then Pseudomonas aeruginosa and this Enterococcus faecalis. So we were having one PhD on one bacteria, a member of the escape organism, and we are still having those phages with us. And they were all characterized, whole genome sequenced, and the endotoxin free. So then we started the therapy. So when the all blood hematological parameters became normal, so we advised to open the wound. You can see the implant here also. This is the huge area. And then again, the fast cocktail of Klebsiella pneumoniae was given at 9:30 a.m. We selected 3 lytic phages for A. baumannii as well. A. baumannii specific fast cocktail was given, mixed in 10 ml saline, irrigated the wound site differently. Evening, we put the 6.45 p.m. and then it resulted in a mild febrile reaction that lasted for 1 hour only. And then TLC was 13.730 and urea and serum were almost normal. So Acinetobacter was not creating much problem, but it was there. We have to cure that one also. So this is the day 9 and 10. The parameters are quite, means 17,900 still it is higher side, but not absolutely normal. Day 11, you can see TLC came down to 10,750 within normal range. And then creatinine and urea, you can see that is also quite lower. CRP came down to 39 milligram per liter. So A. baumannii did not grow after few applications, 2-3 days, there was no growth. But few colonies of Klebsiella pneumoniae were still growing. So we continued the therapy, and we having the intention that continuous 15 days when none of the bacteria is growing, then only we'll stop the bacteriophage therapy. So that took time. We followed it. And then you can see this kept on going. Oh, then again, she got the fever during the therapy. So we cultured the urine and we found that there was another bacteria that was Enterococcus faecium. We tested, it was sensitive to linezolid. We started the linezolid and the urine infection also got cured. She was 61 or 2-year-old lady. So the fast cocktail of A. baumannii was stopped because A. baumannii were not growing. Klebsiella were still growing. So we kept on giving this one. The treating surgeon closed the wound as the blood parameters were normal on day 16. So we again closed the wound because that surface area is very large. Some of the contaminants may be colonizing on the wound side. So we closed it and then we put a catheter inside the wound, so that we are just pushing the bacteriophage solution inside, and then it is percolating to the whole area. But serous discharge was still coming up. This was the growth. This was the dressing done. And this was the, You can see that this was the tubing put there. Through this, the drainage was coming out, and we are pushing the bacteriophage cocktail through this. So this was we are collecting there, and you can see the speed of the total daily we are having 150 to 200 ml of the serious discharge now, and no other bacteria were growing. Only Klebsiella pneumoniae, few colonies were still coming. भागी गए.
Sir, we can conclude.
Okay, but this is not moving. So you can see this. इसको बढ़ा दिया. आगे बढ़ो. So next. The discharge became sterile on 114 day. The discharge parameters next. 153. This 7 wound swab collected on alternate days were found sterile. The phage application was stopped because last 15 days the wound was not having Klebsiella pneumoniae infection, and then we stopped the phage therapy, and the total duration was 5 months we treated. So it means that we can treat the wound infection along with the biofilm formation is there, and also the bone infection can be treated. Next. This is the wound condition after 5 months. Next. She is the lady. So click on. So she did not die because of bacteriophage therapy. Next. These are the course of the treatment. We published this paper somewhere. So it is not progressing. Thank you very much. If you have got any query, any clarification, it will be my pleasure to answer all those questions. I'm working in this area for last 20 years, and we are having good amount of collections. And this was published recently. And the other issue, before finishing it, sir, I would like to add one thing. There is synergy between the bacteriophages and the antibiotics, and the special duration is you give the bacteriophage cocktail first, and after 6 hours, if you are giving the antibiotics, this has got the magic effect. Even though those antibiotics which have been showing resistance in vitro testing, they are effective for killing those bacteria, and magic effect is there. So in this gathering, I can assure you that AMR will not be the major problem in coming days if we adopt the bacteriophage therapy. Thank you very much.
Thank you, sir. Now, if anyone among the audience has any question or any query, maybe 1 or 2 questions we can take.
Hello. Thank you very much, sir. It is indeed a pleasure once again to listen. Hello. I have one question, sir. This is a case study. Could you perform a larger study applying this bacteriophage treatment? Because treating such patients.
There are 2 case control studies. One was on the chronic ulcers, one thesis. Case control randomized control trial was there. I conducted one PhD thesis. The student was from Nepal, and we published it also. Huge number was taken. Then another was the case control study of the roadside accident injuries, which I showed you. And in this case, if persons are coming to us like this, so we are treating those patients on compassionate ground, because the regulatory body still have to permit about this. They are telling that they are the live entities. That's why it is very difficult. They are not molecules. So it is not coming under the purview of the DCGI. It was better that he was there also, the chief guest and the vice chancellor, but he was not there. I tried to convince the 2 director generals of ICMR. They said that you keep on collecting the case reports and try to convince us, then only we'll think about this. So I'm doing that job. I'm just trying to convince them having the case reports like this. So whosoever is coming, we are trying to give this.
So far, hello.
We have treated more than 6 cases of the implant-associated infections. We have treated 3 pneumonia cases, fatal pneumonia-like cases, which these were very serious. Not here from Guntur. There is one physician who is collaborating with me. So we are just supplying to them. That was Pseudomonas aeruginosa and the Acinetobacter. And this implant-associated, we are doing routinely. It takes time, but it is very successful.
So the cumulative effects you have already. So all are effective for all cases.
And there is
That's
no
a
side
great-
effect.
that's
There is
a
no
great-
side effect.
Great findings and that great achievements. Thank you very much.
And another aspect I would be telling you that there is no immune response against these bacteriophages. People say that after several doses, because they are protein in nature, they can induce the immune response. But the fact is that these phages are the part and parcel of our body. They are commensal flora of our body. As you are not having the immune response against Staph aureus, against E. coli, in similar way, our body is not giving immune response against these phages, these viruses, because they are part and parcel of our system.
Thank you, sir.
Okay,
I would like to bring to the knowledge of the students. 22 years back, I was the summer intern in the sir's lab. So this is my pleasure to have you, sir, here. And I did summer training in your lab 22 years back for 1.5 months. And that was a great pleasure. I could learn these things in your lab. Thank you very much, sir. Thank you very much.
Thank you very much. I started this work in 2.5 itself. After coming from US, I started bacteriophage research work. So the total 21 years have been put for this work. And we are manipulating the gut microbiota where they are affecting like ulcerative colitis, Crohn's disease, and the irritable bowel syndrome, and non-alcoholic fatty liver disease also. So we have done on the animal model, mouse model, rat model. They are successful. So,
Sir, I have one question.
yeah.
Can we use this bacteriophage therapy in environmental sample to reduce the MDR? Bacteria.
Definitely. Somebody has to come forward. We can prepare in the bulk, and we have planned to use in the mastitis cases as a part of One Health in the veterinary services. We know that there is a septicemia and the mastitis issue in the big animals, and in big animals, the antibiotic required is 10 times more than what we are using the human being.
Mm-hmm.
So that is not cost effective, but bacteriophages can do that music. And for the environmental sample, you can clean the environment out of Acinetobacter, Klebsiella pneumoniae by using the spray of these bacteriophages. Even in the sewage system also, you can treat the sewer after treatment of the sewage water. You can. And the other thing, before going to this, everybody is excreting these bacteriophages of all types, whatever bacteria you are having in your gut, through your urine, through your saliva. So not to think that they are foreign entities, they are part and parcel of our system. We are simply increasing the number of the phage particle as we were doing in case of antibiotics, and they are very specific, like smart bombs. Nowadays you see that what is happening in the war. They are going and hitting the target only, no other flora is getting affected. That is the beauty of this one. And antibiotics are really very toxic. You don't know what they are doing in the gut and which bacteria is going to be killed. And then because they are usually broad spectrum, so they are just deranging the whole system. So thank you very much. If there are no more questions, thank you. Thank you for giving me this opportunity.
Thank you, sir, for your insightful and thought-provoking lecture. Your reflections on bacteriophage therapy have provided us with a deeper understanding of its potential and pragmatic applications in modern medicine. As a token of gratitude, we request our chair to kindly felicitate Professor Gopalnath, sir.
Sir, please.
Thank you, sir. We now move to our second lecture. It is my honor to invite Professor Dr. Dinesh Yadav, Department of Biotechnology and Director Research and Development Cell at DDU, Gorakhpur University, to present his talk on the topic Protecting Innovation in Health Sector through IPR and Overview. Professor Yadav, may we kindly request you to address the gathering?
Thank you very much. So before I start, I think it was good that the first lecture was relevant to the topic of the conference. The topic which I have selected, because I have been insisted by the convener, Dr. Sunil, that you have to be here and you have to deliver a lecture. I'm not working on this particular area, but since we have been doing a little bit of things with IPR. As a part of intellectual property right, I have been a nodal officer and now taking care of the research and development cell. So I have delivered few lectures with the IPR. This particular lecture is also very important for the students because I will be trying to explain the basics about the IPR. But later on, since this is related with health sector, so I have to do a lot of homework that how I can align it with the health sector. So may I ask to start the presentation? I think they have the control over it. Yeah, this was the topic actually. And I would also like to thank the chair, my colleague, Professor Sharad Mishra and Dr. Vijay Tripathi for this particular session. Now the topic is basically related with the protecting innovations in health sector through IPR and overview. I need to change the slide or? Yeah. So as I have already told you, this was basically insisted by Dr. Sunil to deliver this lecture. So maybe it may not be very relevant for many of you who are working with the antibiotics, but definitely it will be helpful to the students. This was the abstract which I have submitted when he asked me to submit the abstract. So it may be available there. Now, whenever you're talking about intellectual property rights, the first and the foremost thing which is very important for all of us is that we are taking a lot of information from different sources. So that particular sources has to be acknowledged. So since it is an IPR lecture, and if I don't acknowledge the sources, it will be definitely not a good lecture related to the IPR. So I've already acknowledged various sources which I've taken. Many of these sources are from the Google images. And the sole purpose of this presentation is to explain you. So I can take this thing from the Google. It's not that I'm going to copy it for any specific purpose. Now, people are always talking about this concept of Global Innovation Index. Now, this is coming up. Why it is coming up is that it is a direct link with the intellectual property rights. This innovation index globally, it is being taken care of it, and government of India is taking a lot of efforts that how we can increase, how we are going to get a comfortable position in the Global Innovation Index. And the reflection is quite clear actually. Now we are in 39 positions just within the 5 or 6 years. This innovation index, we are reaching higher. And this is mainly because a lot of scientists, a lot of researchers, they are giving a lot of IPRs in terms of patents. They're filing patents, they're filing copyrights, and this scenario is changing. So this is very important for all of us who are doing research. Some statistics I have just put to tell you, the graph will tell you how exactly the number of patents is increasing, which is very important for us also. You see from 2014 to 23, the number of patents which are filed is drastically increased. Not only the number of patents filed is increased, the number of patents which has been granted, that is also increasing. So that is more important. Filing may be an initial step, but many of these filed patents are not getting granted. So it has to be granted also, and that is also increasing. So this is another reflection that we are moving in the right direction. The topic is very clear, why I am talking about the intellect, and the figure is symbolic, gives you a lot of messages. If you try to see this image, it basically tells you that everything has got a price. Everything has a price tag actually. But what about your intellect? What you're thinking? What about your creativity? Whether we have some sort of means to assess that thing, whether we can give some price tag that I have got this price tag and the other person has got different price tag based on his intellect. So that's a very difficult task. Because anything which is tangible thing, which you can feel, which you can assess, that could be assessed in terms of monetary gain. But this thing is a very difficult. So now we have a lot of things which is coming up in terms of IPR. And this IPR is not simply the patent, because most of the time we miss that it is just a patent. It's a different types. And when we talk about different types, you will see this copyrights, trademarks, trade secret, geographical indication, they all comes into the category of intellectual property right. So why rights are important actually? If you try to think in terms of rights, what rights will provide you? A very simple explanation based on the properties right, that if you have a right means you have a right to own it, you have got a right for an exclusive use, you have a right to disallow others from use, you have a right to sell, donate, you have a right to derive profit out of it. So definitely when you have a right means you have a confidence. This is related to the physical things, but whether it could be related with the intellect also, that is what we have to see. So this particular thing clearly tells you what exactly I'm talking about in terms of tangible and the intangible assets. So when we talk about the tangible means, it's basically the physical assets. When you talk about the intangible, it is related to the knowledge. And in that case, if you try to say a little bit difficult is to there to assess it. And how we are knowing that how exactly we can assess there is something which a little bit of understanding of the intellectual property is required. Now everybody knows about him, Thomas Alva Edison. He has got more than 1,000 patents. Now there are other persons who have got more than 1,000 patents also. But the most important thing about is that what he has written is that anything that would not sell, I do not want to invest. Its sale is a proof of utility, and utility is success. So something you can say financial benefit of what you're doing in research, that should be there. And that is, if you're doing some research, something monetary gain you should get out of that thing. And that is the very way what he was thinking. So coming to the topic for the students also, what exactly is an intellectual property right? These are the rights which are given to the person or the creations of their minds. They usually give the creator an exclusive right or the use of his or her creation for a particular duration of time. And when you see the classifications of the intellectual property rights, IPR as such, you have industrial property, you have copyright and related rights, you have got traditional knowledge. But the most important out of this is the industrial property. Because under this category, you have industrial designs, you have got patents, you have got trademarks, and you have got geographical indications. Now coming to the health sector actually, most predominant is the patent and the copyright. Patent and the trademarks, which are well studied also. So I can skip because this is something related which I have already talked, this intellectual property right, what exactly it includes. One thing which is very important is that it is basically related with the geographical region also. Because if you are filing a patent in India, that is relevant to the India, but if you have to file in Australia or something else, again you have to file that patent. So it's basically related with the geographical area also. Now these two slides will give you a little bit of basic information that what are the different types of the IPR. On the basis of, on the top I have given you what is the scope, what is the duration, what is the protection scope, and what is the applicable jurisdiction. So this particular slide will be something where anyone can able to understand and differentiate between the different types of the IPRs. Because when you're talking about patent, what is important is related with the three important things like innovation, you have an inventive step, you have industrial applications. When you talk about trademark, it's just a unique symbol. And that is of more of the trade system. When you talk about the copyright, this is quite relevant with all of us. We used to publish a lot of articles. And then it has to be some basic knowledge about the copyright. So I think this slides I can skip because the same thing I'm going to repeat when I'm talking about the individual aspects. So these are the two slides where I've tried to summarize that how you can differentiate the different types of the IPR. Now coming to the patent, this is the most important thing because whenever you talk about the patent, it is related with something like process of the product. It is an innovation which could be highlighted in terms of product and the process. So this is what exactly are the criteria for getting patent? You will see the subject matter for patent. Basically, there are three important things which they have mentioned in the Indian Patent Act 1970. There has been a modification also in the Patent Act. But the three criteria are novelty, inventive step, and the usefulness. So if you think your process, your product comes under this three category, so there is a possibility for filing the patents. So understanding this novelty, inventiveness, and usefulness is very important. But one more thing which is very important, and the Patent Act has already given a very detailed information. They have also given the list of things which cannot be patented. So I think the students should first see the list which cannot be patented, then only they can think what can be patented. So if you see the different sections, if it's section 3, 4, this has given a detailed information that what could be patented, what could not be patented. So this list gives a very exhaustive list actually. So one should read this list. I will not read each and everything. That is not important here because this is a legal document everywhere present. You just see the sections, you will get the details. But this part is more important prior to knowing that what can be patented. I will skip this part. Now coming to some sort of awareness, because now people, most of the students, they are knowing about the IPRs, and a lot of people who talk about IPR, they will always give you these examples which I am going to give you. First example is everybody knows about the Haldi, the case of Haldi. It was patented by USA, and later on when Indian government came into picture, and at that time Dr. Mashelkar, who was the DG of CSIR, he made a lot of initiatives, and he thought that they have filed a patent which is already mentioned in the Indian system, the healing property of the Haldi. So they fought for this case, and ultimately India government won the case, and that patent was back to the India. So this is a very important event, and later on people realized that the IPR cell should be there, and you will see the CSIR institute, they have, most of the institute, they have the IPR cell for that part. Second important case, again USA. USA is always trying to copy the things. This is again the case of Basmati. So the Basmati was patented by USA in the name of Texmati. So this was a tech company, USA company which filed it. But later on again India got this news, and you know the Basmati's variety is related with a particular region. That flavor is related to the particular region. So you cannot have that sort of flavor. So the claim which they have mentioned with reference to the flavor, that cannot be claimed by them. So again, India won this case. This is the second example. So all these two cases are case of biopiracy. Everybody knows this is happening nowadays because we are ignoring the things, we are not documenting in a proper way. So definitely the other people is going to copy this. This is more important for biotechnologists. Everybody knows about this Ms. Kiran Majumdar Shah. Why I'm giving this is that you can just see the profile of this company. You see the number of patents granted is more than 1,000 patents granted. And they have a lot of products. One of the major company, one of the India's largest biopharma focus. And this all is mainly because of this IPRs. Because when you have an IPR, definitely you have a lot of money you can get. And this is one very excellent example as far as the India is concerned, which is also global concern. Another important, again, Indian picture. Everybody knows that earlier it was assumed in USA that live organism cannot be patented. So this live organism cannot be patented was something which was very important at that time. But Dr. Anand Mohan Chakravarti was working with the bacterial system. So he got some bacteria which has an ability to degrade the petroleum products. And he thought that why not I can patent that particular bacterial strain. So he filed this patent, but this case, Diamond vs. Chakravarti case, is a very popular case. They started saying that no, in USA it cannot be patented. Then he started giving the proofs actually. And the important thing, the claims which he has mentioned, if you see the claims, there are three important claims. The problems are with the third claims, where they have mentioned that the bacterial strain itself. Then he told that, okay, it has been isolated. It's okay, it's a natural thing. But I have modified that bacteria. I have used some sort of vectors. I have used some sort of plasmids which has been modified. So this sort of thing is an innovation. So if you have modified the organisms, it was a live organism, but it has been modified. So why I can't patent? So based on this thing, it was patented. So this is the first time the live organism which has been modified has been patented, and now you know the genetically modified organisms can be patented. So this was the beginning, and the beginning was done again by an Indian scientist. Another important example, actually, again, I have to relate with the health sector also. So this onco mouse, this is again, it has been patented by the Harvard University because it is a genetically modified one meant for some sort of research with cancer. For biotechnology, this patent is also very important. This is related with the gene cloning and expression. And you will know that these two universities, the University of California and Stanford University, they got a lot of millions of dollars based on this one patent. So you can see the importance of a patent. Though gene cloning and expression at that time, it was a very important for all of us. Now it may be very common for us, but you see the patent which they have filed has basically changed these two different universities. So this is the patent registration process. Since we all are knowing this is a legal process, so it may not be very easy for me to describe these things. And most of these students as well as the faculty member, they are not aware of this thing. So we always have some sort of experts, the legal experts, who will file this patent. So these are the basically process, and this is the certificate. When you get some sort of patent, you get this type of certificate. So I'm not going in detail about the process, how you file the patent. But patent filing has got three different stages. It starts with the filing, then there is a sort of screening, it gets published in the journal, and ultimately it may be granted or it may not be granted. So sometimes 3 to 4 years it may take ultimately for the grant of the patents. Now coming to the important thing, because this is something which is important for all of us. When we talk about the patent with reference to the health sector, there are a lot of issues there. Because in health sector, the priority is to save the life. It is not to gain the money by some sort of innovations. So there has been a lot of things happening in case of patent. If you talk about the pharmaceutical industries, India is ranking 4th. Patent system is complex and difficult for them. Patent monopolies, they can lead to overpricing of the drug. This is a very important concern when we talk about the health sector. So introduction of a product patent reduces drug accessibility, and generic drug production faces limitation due to the patent protection. So these are some of the issues when it comes to the health sector. And for that, you have a different way to come out of it. Because if you see which type of things can be patented in the health sector, I have given you the list. Like there can be drug compound patents, there can be formulations, there can be synergistic combinations, there can also be some technological patents, there can be polymorphs, there can be some biotechnology, as well as the process patents. So these are some of the list, the types of the pharmaceutical patenting which is applicable in the India. These are some of the patent laws, and these patent laws are basically for related with health sector. They have some sort of inclination that what has to be done when the patent has to be revoked. If there is some sort of emergency that you cannot think of that patent, it has to be revoked back. So these sections, if you read all the sections, they are somehow related with different types of provisions, and all these provisions are mainly because of the benefit for the humankind. So a sort of relaxation has to be done in case of health sector when you talk about the patents. We cannot always think in terms of monopoly when there is something drug and which is very important for all of us. I can skip many of this slide because I don't want to complicate all of you. I want to make it more simplified here. There are some things which is mentioned in by the FDA with reference to the pharmaceutical patents. They are basically the regulators of this patents information and the providers. And two important things which is mentioned here in the orange book and the purple book, which are exclusively for two different types of things. One for small molecule drugs and the other is for the biologic. So they have documented the list, and based on the preferences, when it is required, the patents related with that particular molecules can be relaxed. So this type of things is mainly done in reference to the FDA. I will skip this thing also. There is some new concept which is coming up in case of patent. One is like patent ticket. This is a very new concept in case of health sector, where the monopoly can be extended more than 20 years in many cases. That is an exception, because most of the time when you talk about the patent, it's 20 years. But in many cases, it has to be extended beyond 20 years. So these types of patents, which could be a primary or the secondary patent, they can be subjected to the patent tickets. So we have the concept of evergreening. Means if you have new patents for the minor changes which you have done, or if you want some sort of product hopping where some sort of new or improved version has to be come into the picture. So patent strategy, which I've just told you that more than 20 years, they can extend it. Extra monopoly has been done in many of these companies. They have got this extra monopoly, like 7 years, 8 years. And mainly because sometimes it happens that it has to be required for that particular company, so they can subject it, though they have to bear a lot of cost for that thing. This is the statistics. If you see as far as the India is concerned, the health sector, Johnson & Johnson has got 43%, the total patent filed by the company. So this is some sort of statistics. And coming to the COVID-19 also, because this is where a lot of relaxation has been done in the patents. There are different strategies. Everybody knows how people started making the vaccine. And when it comes into the pictures, the different types of innovations were made. There are different types of vaccines were made. But at the end, what has happened here, I will show you. This was the end action. You made a lot of efforts, but ultimately it came into picture that we have to waive off. We cannot go for the patent because it is an urgent, it is the pandemic, so we cannot think of the patent. So this was the things. At COVID-19, patents could not be considered at that time. Because if the patent was there with some sort of particular companies, then it would have been a very difficult situation. So as you see in health sector, there has been a sort of relaxation when we talk about the patent system. Now coming to the trademark. Trademark, I think everybody knows, because just by seeing particular symbol, they recognize that this is a particular company associated with it. So when you talk about the trademark, it is to identify the origin. It will tell you something that how you can distinguish the product. It can also guarantee the quality of that particular product, and it is basically meant for the advertising. In case of health sector, you will see there are total of 45 classes are there. Out of these 45 classes, 34 they are related to the product, and 11 are the service. And class 5 is related to the medicine, which is specifically for the trademark for health sector. And these are the total 45 classes. And this class 5 includes the different products, like it can include the sanitary preparations, it can include deodorants, it includes the dietary supplements. So each section, subsections they have, that if you have a trademark, it will be under this category. So you have to know the classes where you can go for the particular trademarks. This is the trademark certificate. Coming to the trade secret, this is something where there is not much legal complication there. The only thing is that if you are able to maintain the secrecy, that trade secret exists. So there is nothing like document you have to file for it. So this is there. For example, these two things, KFC and Coca-Cola, everybody knows this is still existing. So as long as you maintain the secrecy, the trade secret will maintain. So there is no duration for it. As you see, the patent has got a specific duration. Copyright has a specific duration. Trademark has a specific duration, but it doesn't have that duration. Then comes geographical indication. I don't think it is directly related to the health sector, but this is very important for all of us. It is not an individual effort. It is more of a community effort. It's a lot of people has to come if they want to file for the geographical indication. What exactly it is? Geographical indication is basically something which is related with various type of product which has got importance because of its region. That is more important. Geographical indication relate to that thing. So these are basically related with agriculture products, foodstuff, wine, handicrafts, industrial product, and it is registered under the Registration and Protection Act 1990, which has been slightly modified. It exists for 10 years. It can be extended later on. In Uttar Pradesh, which is it has got the highest GI tax. There's a lot of lists there. You can think that these are under the category of GI tax. And in Gorakhpur, you know about the terracotta, which has recently got this GI tag. Panyala is also in the process. Kalanambak has already got the GI tag, but though it's not covering entirely the Gorakhpur, it is covering Siddharth Nagar. So I have not mentioned it. This is the copyright is another thing which has got a wide spectrum. It's not just publication. If you see at the bottom, I have mentioned many things. It may be including the literary works, computer programs. It has films, musical components, artistic work. So the only thing in terms of patent and copyright is that patent is an innovation, an idea. And this is an expression of idea. If you have expressed your idea in terms of this thing, it becomes a copyright. So it doesn't have that much significance as compared to the patent. It doesn't have your significance in terms of monetary gain what you're thinking. The only thing is that when you have a copyright means that you are protecting the other person not to copy that thing. That's the basic purpose. So I can show you this thing. Then in Indian scenario, this is one important thing which is only there in India, and this is called Protection of Plant Varieties and Farmer Rights Act 2001. So you cannot patent this thing, but in USA you can patent the plant system also. So in this, there has been a system made where incentive is provided to the researcher, incentives can provide to the farmers, incentives can provide to the breeders also. So this is a very good strategy they have developed, and this act has helped a lot of farmers who are protecting a particular variety for a longer duration to get the incentives. Then there is also one concept which one should know, that it doesn't mean that one product, one IPR, it's not like that. There is one product can have multiple IPRs, and a very excellent example is your iPhone. It has got patent also, it has got copyright, trademark, everything it has got. So this is how the one product can have the multiple copyrights. These are the organizations, if you are interested, you can see this is already available in the websites also, that where these organizations are there in terms of patent office, copyright and other offices. WIPO is the major organizations. If you are more interested, you can visit this website and you will see more than 193 countries are there, and they are helping us to discuss about the IPRs. But IPR is now becoming a very global issue nowadays because of the money which is involved with the IPR. In Indian scenario, you will say this is a website, Controller of General Patent Designs and Trademarks. For students, visiting such website is very important. They might be visiting a lot of websites, but this type of website, they will definitely help you to know that what is happening in the India or what is happening globally with reference to the intellectual properties. This is the website of the PPURF, which I have told you. In DBT also, we have a TIFAC, and this TIFAC has got Patent Facilitation Center, which provides a lot of information. It will assist you in filing the patent also. Then another important thing which is developed by CSIR, the Traditional Knowledge Digital Library. And you know, this is something which is now very important because we have already seen the cases of biopiracies. So if something is already documented, then there will not be any cases of the biopiracy. Another organization which is there in Pune and Delhi, which is also providing a detailed information of the intellectual property right. These are some of the websites. If you are interested, you can visit this website related to the IPRs. But now the few slides, because I have to justify myself also that I am doing research. So I am also doing some research. There are two areas. We are working with the plant system, plant biotechnology. We are working with the plant transcription factors and a little bit of with the microbial enzymes. We got filed and some published patents around 10 and some copyright got registered. So nothing granted as such, but we have started thinking in terms of the IP. So these are the patents, these are the copyrights from which has been registered. And these are some of the publications. Again, I am justifying that I can talk on IPR. So I have published a lot of, at least some chapters and research papers related to the intellectual property right. This is the chapter from where I am discussing today, which was published recently in 2022, where we have mentioned intellectual property right in healthcare sector. Now, another important responsibility, since I am taking care of research and development cell, so I would like to tell you that Honorable Vice Chancellor Madam has done a lot of initiatives with the IPR. And our research and development team and IPR nodal officers, we are trying to help the researchers, the students to file the patents. And the outcome is quite clear. If you see how many patents, the data clearly tells you the total number of patents which has been filed. Total is around 296, includes the copyright, the patents and all. So this is just within the last 2 years. I think Professor Sharad Mishra also knows how we are working with this IPR in entire university so that we can know that this awareness is important. So this sort of awareness is going on. Some of the things we started with when it was COVID, we did an online week IPR workshop. Then from UPCST, we got continuously third time, we got some sort of financial support for awareness programs. So these are some of the figures you can see here. And finally, thank you. And one more thing, and thanks also, there is something which is very important. This Rangoli has got the registered, and this is mainly because of the MSc Biotechnology students. So they got 3 Rangolis for the 3 workshop, got registered. So this is also a sort of innovation. It is important for them to realize what exactly is IPR. Thank you very much. If you have any question, I would like to.
Thank you very much, sir, for such informative and innovative talk. Now, I would like to invite any questions.
Yeah.
Thank you, sir, for the lecture. Sir, I just wanted to ask, like, in humanities and in literature,
Yeah.
how do we go with the patent? Apart from copyright, we have been talking in literature, like novels and poetries, we were going with the copyright. So how easy it is to go for a patent in humanities?
Actually, yeah, the problem is that I've already told you for the patent, the more important thing is it is related with the process and the product. So definitely, I don't think there's any chances related with the humanities in terms of patent research. So you have a copyright option is there.
But sir, I have seen my professor have undergone a patent recently related to the COVID-19 something. So maybe that
Maybe
you said
that's what I'm saying.
The idea.
If the 3 conditions, the 3 criteria, if they are trying to fulfill that thing, so definitely they might have got the patent. But exactly how they have tried to align with these 3 criteria, I don't know exactly. So that could be case specific.
Thank you, sir.
Okay.
Anybody else? Any other question? Yes.
Good afternoon, sir.
Good afternoon.
So my question is related to IPR policy.
Yeah.
My question is, how will genomic and personalized medicine impact IPR policies?
How?
How will genomic and personalized medicine impact IPR policies?
See, IPR policy in general, it is not aligned to some specific topic as such. I have already told you that when you talk about the health sector, there has been some sort of relaxation there. So any IPR is going to influence any of these streams, whether it is personalized medicine, whether it is the genomics, and there are a lot of patents which have been filed with reference to the genomic-based technologies. I think most of the genomic-based technology, if you see, there has been a lot of patents. So policy is not very specific to the specific topic as such. They have a general IPR policy. For example, in India, they have an IPR policy. So that IPR policy will take care of the different aspects. It may have some sort of relaxation with the different types of things with reference to the health sector. But all this IPR is going to influence these innovations, whether it is the innovation related with genomics, whether it is related with the personalized medicine, whatever it is. Okay.
Thank you, sir.
Thank you.
Thank you, sir, for your comprehensive and enlightening lecture. Your perspectives on safeguarding innovation through intellectual property rights have highlighted a crucial dimension of healthcare advancement. With this, we bring technical session 1 to a close. As a token of gratitude, we request our co-chair to kindly facilitate Professor Dr. Dinesh Yadav with a memento.
I think we have concluded the first technical session. इस टेक्निकल सेशन में 2 बहुत ही इम्पोर्टेंट टॉक्स हुए. पहला जो टॉक था बाय प्रोफेसर गोपाल नाथ फ्रॉम IMS-CHU, जिन्होंने बैक्टीरियोफाज थेरेपी के बारे में बताया. यहाँ पे स्टूडेंट से इसलिए मैं बात कर रहा हूँ. जो पैथोजेंस होते हैं और जो हम ह्यूमंस हैं उनके बीच देयर इज अ कॉन्टिन्यूअस स्ट्रगल, लगातार संघर्ष चल रहा है। हम कोई मेडिसिन लाते हैं, कोई एंटीबायोटिक खोजते हैं, फिर कोई थेरेपी खोजते हैं, तो जो पैथोजेंस हैं वो रेजिस्टेंस डेवलप कर लेते हैं, अडॉप्ट कर जाते हैं। ये हमारे लिए बहुत बड़ा चैलेंज है। तो उस दिशा में जो हमारे साइंटिस्ट हैं वो भी नई नई थेरेपी खोज रहे हैं। तो एक बहुत बड़ा संघर्ष चल रहा है, किसके साथ? बैक्टीरिया के साथ और वायरस के साथ। इसलिए मैं आपसे आग्रह करता हूं, आपस में मत लड़ो, लड़ना है तो बैक्टीरिया से लड़ो या वायरस से लड़ो, और अपनी शक्ति को समझो। एक वायरस क्या कर सकता है याद है ना? तो अपने ऊपर घमंड भी मत रखो कि मैं सर्वशक्तिशाली हूं, या ये समझो कि जो ह्यूमन है बहुत ही बुद्धिमान, यही बताया जाता है। ऐसा कुछ नहीं है। एक वायरस आता है तो आप अपने घर में दुबक जाते हो, पता नहीं रहता कि कल जिंदा रहेंगे कि नहीं रहेंगे। तो लड़ना ही है तो बैक्टीरिया से लड़ना है, वायरस से लड़ना है। ये जो बहुत ही हमने नेचुरल, प्रोफेसर गोपाल नाथ जी ने जो बताया कि नेचुरल सिस्टम को ही हम नेचुरल सिस्टम को डिफीट करना चाहते हैं। बहुत सारी थेरेपीज आ गई अब तो, आपकी जीन थेरेपी या स्टेम सेल थेरेपी, बैक्टीरियोफाज थेरेपी, बहुत सारी थेरेपीज आती जाएंगी, जिसमें आप जैसे जो नए स्टूडेंट जो इनोवेटर्स बनेंगे, साइंटिस्ट बनेंगे, उनके लिए बहुत बड़ा स्कोप होगा। तो बहुत ही इंपॉर्टेंट लेक्चर। जो दूसरा लेक्चर, वो भी आप स्टूडेंट्स के लिए बहुत ही इंपॉर्टेंट है, बहुत महत्वपूर्ण है, क्योंकि रिसर्च में आप क्यों जाना चाहते हो? हर इंसान की इच्छा है नाम और पैसा और इज्जत, ये तीनों चीजें इसी से मिल सकती है। स्टूडेंट्स कंफ्यूज होते होंगे कि क्या है रिसर्च में, क्या रखा है, क्यों, कब तक रिसर्च करेंगे, क्या करेंगे। ऐसी बात नहीं है। जो अभी प्रोफेसर दिनेश यादव सर ने बताया कि किस तरह से आप पेटेंट के बारे में, तो हम तब जागे जब हमने देखा कि हमारी ही चीजों को अमेरिका और जो यूरोपियन कंट्रीज है वो पेटेंट करा रही है। इसका मतलब आप समझते हो, यदि वो पेटेंट करा लेंगे तो उसी का यूज करने के लिए आपको उनको पैसा देना पड़ेगा। आपकी चीज वो पेटेंट कराएंगे। बहुत सारे एग्जाम्पल्स है। हल्दी का एग्जाम्पल आपने बताया, नीम का बायोपेस्टिसाइड बनाया। नीम तो इस देश में 5000 साल से यूज हो रहा है पेस्टिसाइड के रूप में, लेकिन उन्होंने एक फार्मूला तैयार किया, बायोपेस्टिसाइड बनाया और उसको पेटेंट करा लिया। ये सारे के सारे पेटेंट्स रिवोक हुए, क्योंकि उस समय जैसा कि आपने बताया आर मशेलकर डीजी थे CSIR के, उन्होंने इंटरनेशनल कोर्ट में केस किया और भारत जीता। तो ये हमारे सामने है। तो कोई भी इनोवेशन यदि आप करते हैं, पब्लिक यूटिलिटी, जो पब्लिक के यूज में है, जो लोग यूज कर सकते हैं, जैसा कि थॉमस अल्वा एडिशन का स्टेटमेंट, बहुत ही इंपॉर्टेंट स्टेटमेंट। आई डोंट नो हाउ कुड यू मेक, वेदर व्हाट इज बिहाइंड दैट स्टेटमेंट। उस स्टेटमेंट का सिर्फ एक मतलब था कि हम जो कुछ भी करें वो ह्यूमैनिटी के लिए करें, फॉर ह्यूमन वेलफेयर के लिए करें। ह्यूमन वेलफेयर के लिए होगा तो ह्यूमन उसको यूज करेंगे, उसका सेल ज्यादा होगा। तो पेटेंट के बारे में बहुत ही रोचक और बहुत ही शानदार, बहुत डिटेल में आपने जो व्याख्यान दिया, मुझे उम्मीद है कि हमारे स्टूडेंट्स जो इसको इन्होंने सुना है, इससे काफी बेनिफिट हुआ होगा और आगे चल करके आप इस पे और आगे बढ़ेंगे। तो ये लेक्चर लंच होने वाला है, मैं ज्यादा वक्त नहीं लूंगा। So I am thankful to the organizers, Professor Sunil ji, and the whole organizing team for inviting me and giving this opportunity to chair the session. And the session, which the speakers were two stalwarts of their own field, Professor Gopal Nath, Professor Dinesh Yadav. So I am again, thank you so much. Thank you.
Thank you, sir. We request our Dean and convener of the conference, Professor Dr. Sunil Singh, sir, to kindly felicitate our chair and co-chair with a sampling as a gesture of appreciation. हो गया? Thank you, sir. We extend our sincere thanks to our distinguished speakers for their scholarly contribution and to all participants for their active involvement. We shall now proceed to